Diabetic retinopathy. Diabetes is a disease affecting the entire body where someone's blood sugar is elevated. This can lead to a wide array of changes in the retina with a wide range of severity of vision consequences. It is important for patients with diabetes to get regularly screened by an eye doctor, as examination of the retina can reveal changes to the retina that patients may be completely unaware of. Sometimes these changes can indicate that certain interventions are necessary in order to prevent the disease from starting to affect a patient's vision. Simply stated, when diabetes affects the retina, the peripheral areas of the retina oftentimes don't receive enough blood flow. These areas of essentially hungry retina release signals into the eye indicating that they need more nourishment. For those who like to nerd out, the primary signal of retinal hunger is called vascular endothelial growth factor, or VEGF. Two major consequences can happen from these hunger signals. One, the vessels of the retina, especially those that supply nourishment to the center of our vision, can become leaky. As such, fluid can leak into the center of the vision of the retina, causing vision to decrease. This is called macular edema and is treated most frequently with injections into the eye to improve and prevent worsening of vision. Another major consequence is that abnormal blood vessels can start to grow entirely. This is called proliferative diabetic retinopathy, as new blood vessels proliferate. This can sound good, but in actuality, these abnormal blood vessels can break and bleed into the eye, causing vision to decrease. In more severe cases, these blood vessels can grow into large sheets that will pull on and detach the retina off the eye wall, or can start to grow in the front of the eye and block the drainage of the eye's natural fluid, which can cause very elevated eye pressure and eye pain. In these severe cases, the prognosis of maintaining useful vision in the eye can be poor. Therefore, it is very important to treat this before it gets to these nasty stages. Treatment of proliferative diabetic retinopathy can also involve injections into the eye, as they can cause abnormal blood vessels to go away. However, since the effect of injections can be short-lived, many physicians often recommend a laser procedure called Panretinal Photocoagulation, PRP for short, where the peripheral hungry retina is lasered for a more permanent treatment of these abnormal blood vessels. This laser treatment is oftentimes performed in office. However, in cases where there is bleeding preventing the view of the retina or sheets of vessels that are detaching the retina, surgery may need to be performed to clear the blood and apply this laser. It is important to note that PRP will not treat macular edema, so some patients may still require injections in their eye to be able to achieve the best vision possible. Overall, it is important for all patients to work closely with their physician managing their diabetes care. Good control of diabetes from the beginning will prevent these nasty vision-threatening complications from occurring. Further, in patients who already have had diabetes start to affect their retinas, diabetic retinopathy can still remain and progress even when better blood sugar control is achieved. That said, however, controlling blood sugar will not only make eventual retinopathy treatment easier, but will also have tremendous benefits to the rest of the body.